Ask the Messengers, the program that deals with substance abuse. Real people telling real stories. Where there is addiction, there is a chance for recovery. We're trying to help save lives on Ask the Messengers.
Wednesday, March 11th, 2020 was the day when the World Health Organization publicly announced the coronavirus a pandemic, known to us as COVID-19, that soon gave the entire world a new normal way of living. Then President Donald Trump downplayed the virus on several occasions while many were fighting for their lives and families were trying to adjust to what caught us all off guard. Even with massive virus testing results confirming the pandemic was out of control, during Trump's campaign rallies, he urged to slow the testing down, as if that were going to make it all go away. Oh yeah, he said it was going to go away by Easter. Remember, it's going to warm up. It's just going to disappear. Each day after this pandemic was officially announced, the reality began to set in that an alarming rise in deaths, hospitals, and funeral homes became so overwhelming that freezer trucks were used to store the dead bodies.
This is for real. This is for real. This is Brooklyn, y'all. Family, y'all take it serious. Y'all take this thing real serious, y'all. This is for real. This is for real, y'all. This is for real. This is real. This is right here in Brooklyn. This is right at Brooklyn Hospital. Y'all, this is for real. They put the bodies in 18-wheeler, y'all. This is live from Brooklyn, New York. Brooklyn Hospital. They're putting bodies in the back of a freezer truck, y'all. Please stay inside. This is for real. This is for real, y'all. My hand is shaking because it's hard to look at this right here, what I'm seeing right now. It's hard to believe this. But y'all, this is for real. Please, please, y'all stay inside. This is real, y'all. This is coming right now. I'm right here now, right here outside the hospital. This is going on right now. This is live, y'all. This time is 10:40 Sunday morning. This is down. This is down.
In our lifetime, we would have never dreamed that there would be a toilet paper shortage. Basic household disinfectants were hard to find. And if you did find them, they were all overpriced. I mean, $20 for a can of Lysol, and who knows how much for a pack of toilet paper. Then came the mandatory lockdowns all around the world, first starting in Italy and soon all over the rest of the world. Kids were out of school, places of business shutting down, and many have closed for good. Zoom and FaceTime became the safest way to conduct businesses, hold classrooms, and even connect to our loved ones. Every news-related network consumed our lives with coronavirus updates, from deaths to how people were coping. Stay home, stay safe, and learn how to properly social distance became the norm. Now here we are a year later. The vaccines are being distributed, and many have been vaccinated. But for so many reasons, maybe for religious purposes, personal preference, or many other conspiracy theories, many are still deciding to take the vaccine or not. Most are simply exhausted from it all. Domestic violence, abuse, child abuse, depression, suicide, alcohol, and substance abuse numbers continue to rise. Today on the Ask the Messengers TV show, we go one-on-one with director of the Forgotten Harvest, which is the food distribution organization, and he's here to tell what distributing food for a major organization such as themselves, what was it like during the pandemic. Also, Monica Hickson, author of the COVID Diaries, The Last Days of My Normal, is here to talk about and share what it was like to experience COVID firsthand. The Ask the Messengers TV show begins now. This book is dedicated to the families that have lost loved ones to COVID-19 during the global pandemic. This nightmare will one day end, and hopefully you will find peace and comfort where there once was none during such a pivotal time in our world. Welcome to the show, Monica Hickson. The COVID Diaries, the last days of my normal.
Thank you for having me. I appreciate you for actually taking the time to interview me.
So, how'd you come about getting it together to create this book?
Well, as you know, he got sick early on. So early on, we weren't able to have funerals or gather. So he never had a memorial service. He never had anything. I wasn't even able to go see him in the hospital prior to him dying. And I'm like, somebody has to do something for these people, especially for David.
Mm-hmm.
So I didn't know how to honor him. I'm like, okay, I can't have a funeral. I can't have a memorial service or anything. And his family's in California, and he didn't have much family anyway. So it's like, how can I honor this man? And also, how can I honor the 500,000 plus people now who have died in this country alone, and those family members who are still grieving? So it came out of me just kind of wanting to make sure that this is never forgotten. Not any of the victims, not the family members, and especially David Norman Reed.
I know that you're a journaling person. So did your journaling help you do this?
Yes, Tina, I have journaled all my life.
Okay.
But it seems like when I journal, it's only when things are going sideways. Nobody really thinks to journal every single day if things are going wonderful. And what happened, I was journaling, and journaling definitely helps me, along with some other things like prayer and meditation. But journaling, not typing, but actually picking up a pen, normally purple, and just journaling.
Right.
Kind of what came to mind. And now I'm like, who would want to read it? But then when I thought about David, I'm like, oh, people are going to want to read this, because if nothing else, it was the coronavirus. It was COVID. It was a pivotal time in our history where people are dying left and right. I don't think there's anybody that I know that has not been personally touched by this. Mm-hmm. So writing my journal, I just, you know what? I'm going to kind of make it as if it were a journal. Mm-hmm. But I'm going to also add in the back of the book something to be helpful, not just me and what happened in my circumstances, but also what's going to be helpful for the other people, because you can't write for yourself. You got to bring something to the table to go with it. And what I did is I also talked about the different types of grief, not the stages of grief. People know about the stages, but many don't know about the types of grief.
Grief, what is it? You most likely have already gone through some form of grief in your life. Whether it was a loss of a person, a relationship, or a job, grief is inevitable and multidimensional for individuals with losses. But this book focuses on grief during a pandemic, specifically during COVID-19. Now, how did you come up with the thought that there's a difference like that?
It was a difference. I mean, nothing was the same. Like, even from dropping them off, we're used to, going and advocating for our loved ones, especially like in the old days, my grandmother would say, oh, we're going to go up to the hospital because we want these doctors to know that this person's not a throwaway. This person has a family. So we're used to doing that. We're also used to, if someone does pass on, people are coming over with spaghetti and fried chicken and pound cake. And all my family could do was drive by in a caravan on my street, which I appreciated, but I wanted a hug so bad. And everyone knew that I was probably contagious because I was caring for him prior to his death. And it was horrible not being able to have the family members around. You know how we are. We're, even in the midst of grief, we have family. And I didn't have that. I had my son and I were grieving alone. And it was a hard grief because I had just lost my father 11 months before this.
Yep, I remember.
So that was already, the year was already kind of a weird year for me. And then when David died, I had nothing left. And so it was compounded grief. And I talk a little bit about the different types. And when you have, I don't want to give too much away, but when you have the loss of a person, but you also have the loss of an income or the loss of stability or the loss of, your sanity. I mean, everything compounds. So this was totally different. And when I hear people say, oh, I get it, I lost my dog or something, it's like, I understand, I appreciate that. However, were you able to go to the person or your animal? Were you able to actually have a burial? And there's people who have not been able to do that. And the grief on this time is just really compounded. That's kind of the point I was trying to get at the book, to say, hey, when you're supporting these 500,000 families, please be gentle and understand there's a lot more underneath the surface that you don't know about.
How can someone get the book?
Yes, if you want to purchase the book, it's on Amazon, but I would prefer, if you want a signed copy, you can go to my website, monicahickson.com. That's HICKSON.com. And you can order through the link on the last page. And if not, you can always go through Amazon, but it'll say that the book is sold out because there was 2 versions of the book. So if you type in my name there, but come to my website, you'll learn certainly a lot about me at that point.
On behalf of Ask the Messengers, our staff, when I told them we were doing this, they were like, yes, please let her know that she is forever in our prayers. And trust me, when they say that, they mean it. So you are definitely in the Ask the Messengers prayers, meditations, and all the soliloquies that go with it. Is there anything that you just wish that someone asked you that you want to say?
One thing I want to say that I haven't coined this term, but if I can, I would, is that think about it for a moment. How can I get over something that we're all still going through?
And we are still going through it. It's crazy. We just gotta hope and pray. Vaccines are out. We won't get into the vaccine if you're for it or against it or whatever, but I want people to really soul search and dig into their own consciousness and decide for themselves what to do as far as the vaccine is concerned. Do you agree with that?
Yes, I have been vaccinated. It was something I did have to soul search for because I'm in a different position where I had someone almost die in my house. So, but I did have to soul search, but I've had both shots.
Stay tuned for more of Ask the Messengers.
Hi, my name is Artesia Washington, and I'd like to welcome you to Irvine Neuro Rehab, where we help you reach your goals of rehabilitation. So you ask, why choose Irvine? Now here at Irvine, we offer physical therapy, occupational therapy, speech and language pathology, counseling, aquatic therapy, and massage therapy. And we help build you back to your previous level of functioning. Give us a call, 248-415-2500, www.irvineneurorehab.com.
I'm Wayne County Treasurer Eric Sabri, encouraging all taxpayers to please take advantage of the several payment options available.
You can pay online by visiting the Wayne County Treasurer's Office website. Paying online is easy and convenient.
You can also download the mobile app and pay with your smartphone.
You can pay at one of 70 kiosks located throughout Wayne County.
And yes, you can always still send in your payments using the U.S. Postal Service.
If you have to visit our office in person, you must make an appointment by going to treasurer.waynecounty.com. It only takes a few minutes. Facial covering or a mask is required and social distancing is observed. Your health and safety is very important to us. You can also email our office at taxinfo@waynecounty.com or call us at 313-224-5990.
Underage drinking is responsible for more than 4,300 deaths of youth annually. DWIHN, along with its provider partners, strive to educate young people on the deadly dangers of alcohol use and abuse. We teach youth about the dangers of drinking especially when driving. If you are looking for resources to share with your loved one, give the Detroit Wayne Integrated Health Network a call 24/7, 800-241-4949. Here to talk, here to help. More than 2.5 million Americans are addicted to opioids. The addiction is sometimes developed through the improper use of prescription painkillers. Using prescribed medication in ways or amounts not intended by a doctor is very dangerous. So it's important that unused prescriptions are properly disposed of. If you or someone you know is struggling with addiction, or for more information about prevention, treatment, and recovery services, or how to properly dispose of medication, contact the Detroit Wayne Integrated Health Network 24/7, 800-241-4949. Here to talk, here to help.
We are back, and I would like to again thank Monica Hickson for sharing her story about her fiance and about her book and what inspired her to do so. Now we're going to go to another a guest of ours, Kirk Mays, who is the director of Forgotten Harvest, and I just kind of wanted him to share with us what it was like for Forgotten Harvest during the pandemic. So how did you guys, first let me welcome you to the show and just get right into it. The pandemic hit, you guys are so used to feeding people, and bam, what happened?
Tina, thank you for inviting me on the show. It's quick and to the point. The community stepped up to get behind our back. You know, we needed volunteers to be deployed into places where there was shortages for distribution. A lot of the places that give out food on a regular basis are manned by volunteers and manned by senior citizens and folks who are doing their best with the time. And a lot of places had to shut down. So we repositioned some of our distributions by having some self-directed, what we call on the site, Forgotten Harvest on the go, which we then turned into like our super sites for this situation. So without volunteerism, we weren't going to be able to do this. At periods of time, we had to buy food, so the support from the community and resources helped us to buy food where we were finding shortages in our natural food stream from grocery stores and that kind of stuff. And then, you know, when the CARES Act food came in May or late April, it really did provide like a sustainable backbone for the food that we are putting out there now. And it's all kind of like being sourced from, you know, nationwide from a lot of different vendors to get it to different food organizations throughout the community. So a number of things that we had to reposition internally, but we had to do a lot of things that we had to change up for our, you know, public facing business. And I think those are the things really supported by the community that helped us stay on pace and, you know, stay in the game even to today to help people out.
So now I was going to say, now we're a year later. Has that need dissipated now that we're a year later, or is it still up there?
I wish I could say that it's gone down, but the need is still high. You know, I think what we're seeing is the rise of the numbers is you know, leveled off, but there's a sustaining need that's still persistent need that's still coming to us on a daily basis in the lines that we're serving. And depending on what area in Metro Detroit and you know, what time of month and that kind of stuff, you could see numbers go up and down. But there's been a consistent need for additional resources, for food resources for the whole last year. But there's been some surprising need in areas that you wouldn't typically assume that you're going to get that kind of level of request of food. So so far, one of our highest output locations as far as people coming in and the food given out has been our Oak Park location. And that's like at the Oak Park Recreation Center.
Okay.
One of the other huge areas that, you know, had huge lines for us when we opened up was in Sterling Heights. We did that about, I think, 6 weeks or so ago. And, you know, when we first get out there, the lines were 2 miles long. And by the time we ran out of food and we were getting to the end of the line was still 2 miles long.
So I noticed that. So what are some of the, like, if people want to find distribution sites, do you have a process? How does that go for people that need to get get your help?
Yeah, so for Forgotten Harvest, we've been posting our distribution locations on our website every week since the pandemic began. So you can go to the www.forgottenharvest.org page, and on there should be a link to a COVID support page. And somewhere near the middle or the bottom of the page, there's each day of the week should then have a pull down or some kind of expansion section that you can see locations that we're serving on those particular days.
Okay, and with Forgotten Harvest, there's no economic
No,
that
we
you
don't
need
charge.
to fit in, right? No, I mean not charge. I'm saying like who you service. There's not a level of poverty or a level of non-poverty. I don't know how to say that because I'm not in that field, but do you have to make a certain amount in order to qualify, or is it just open to the general public?
Yeah, so we don't set those requirements for our food distribution partners. So if we drop off food at Capuchin or we drop off food at Northwest Activity Center, wherever it might be, one of our normal partners, we typically are trusting, and with the process that we have in setting those relationships up, we're trusting that they're serving a vulnerable population in that community. As far as the Forgotten Harvest on the site or emergency pantry locations, generally, I've been in the community and doing community work for years, and my rule of thumb is if somebody is standing in line to get some food, they're there because they need it.
Right.
So if you ask us for it, pretty much that you qualify, and we try to do what we, especially right now in the midst of a pandemic, how could I judge whether or not somebody has a changing situation or a transitional moment where they need help? And that's what we're here for. We're here to help people in need. So that's what we're trying to do.
You guys are getting is this a new location that's going to be a permanent?
15,000 West 8 Mile, at the corner of 8 Mile and Hubble on the Oak Park side, is actually going to be the home of Oak Park, home of Forgotten Harvest for the foreseeable future. Once complete, it's a 77,000 square foot facility, upstairs and downstairs. The upstairs will hold our administrative staff. Right now, we have 2 offices that we're maintaining with our Greenfield location, and we have an administrative office in Southfield that we also holding up because we can't all fit in Oak Park.
All right, Kirk, thanks again. You take care of yourself. Again, if anyone needs food or want to be a partner, go to the website. You see the information right there on the screen, and Kirk and his crew will be happy to serve you.
We'll be right back with more of Ask the Messengers.
If you or someone you know is battling with any type of cancer, you need to read the book by Laverne Moore Slaughter, God Encounters Are Real. In her book, she tells how through prayer and faith, God healed her and set her free from stomach cancer. For more information and to get your copy, visit www.encountersarereal.net.
I'm Wayne County Treasurer Eric Sabri, encouraging all taxpayers to please take advantage of the several payment options available. If you have to visit our office in person, you must make an appointment by going to treasurer.waynecounty.com. It only takes a few minutes. Facial covering or mask is required and social distancing is observed. You can also email our office at taxinfo@waynecounty.com or call us at 313-224-5990.
Underage drinking is responsible for more than 4,300 deaths of youth annually. DWIHN, along with its provider partners, strive to educate young people on the deadly dangers of alcohol use and abuse. We teach youth about the dangers of drinking, especially when driving. If you are looking for resources to share with your loved one, give the Detroit Wayne Integrated Health Network a call, 24/7, 800-241-4949. Here to talk, here to help. More than 2.5 million Americans are addicted to opioids. The addiction is sometimes developed through the improper use of prescription painkillers. Using prescribed medication in ways or amounts not intended by a doctor is very dangerous. So it's important that unused prescriptions are properly disposed of. If you or someone you know is struggling with addiction, or for more information about prevention, treatment, and recovery services, or how to properly dispose of medication, contact the Detroit Wayne Integrated Health Network, 24/7, 800-241-4949. Here to talk, here to help.
Our life truly has forever changed based on what we have experienced in the pandemic. we really are all exposed to factors that can lead to trauma. The first thing is even coming out of social isolation and physical distancing. I would say, the first real consideration is that would be in conjunction with like your medical professionals, just whether or not it is safe for you to go ahead and leave. For some people, within the next year is not the time period for them to go to crowded spaces and just take baby steps. Start with the grocery store, or start with the post office, and then graduate up to something like the beach or the park. Kind of increase your exposure to crowded spaces. A lot of people now will be taking into consideration what common spaces and common items that they touch with their bare hands. We're going to become more accustomed to just seeing people walk around with masks on more of a regular basis. Be mindful of those overall hygiene things that will help you to feel safe. Explore the idea with your employer of whether or not it's possible to go back part-time and gradually increase the amount that you are at work. What we don't want from like a therapist, a mental health professional standpoint, is that you throw yourself into the middle of the scenario and then you do have a panic attack, because that's going to make it that much more difficult for you to want to return to that situation again. You want to challenge your anxiety, but you don't want to fully activate it. Just be kind to yourself, be kind to your family, to your friends, because it's going to be an adjustment period getting back in. Kids are they might not express the fact that they notice your stress and your anxiety and your worry or your frustration, but they do pick it up. We are experiencing like the development of PTSD and anxiety disorders in real time. And so for a lot of people, they're not realizing that they are in the middle. I'm not saying that everybody is experiencing this, but everybody is experiencing a pandemic.
We'll be right back with more of Ask the Messengers.
Won't you help us to do exactly what our motto is, and that is to help save lives? Won't you send a generous donation to the information there on the screen? We would love to have you as part of our partnership to help save lives. You may not be able to go out in the street, you may not be able to come here to the show, but you can send your donation that helps us save lives.
We will forever be indebted to the frontline workers, the grocery stores, restaurant delivery services, our state and federal officials, the memorial tributes, and everyone who still continues to do whatever they have to stop the spread. To vaccine or not to vaccine? That is the question. What will normal look like in the future? Only time will tell. This is Tina Nelson for the Ask the Messengers TV show, urging everyone to continue to stay safe and continue to do your part to stop the spread of COVID-19. The year 2020 will forever be a year we will never forget and hope we will never experience again.